Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body. And if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Diana Schwartzbein. Dr. Diana Schwartzbein is an endocrinologist who 20 years ago was one of the first to debunk the low-fat movement in her first book, The Schwarzbein Principle, published in 1999. Her principle states that degenerative diseases of aging are not genetic. They're acquired through poor nutrition and lifestyle habits. Since the publication of her first book, she's written several others, The Schwarzbein Principle 2 and The Program. All of these books focus on how the hormones of the body affects your health and how your daily habits affects your hormones. Through her nearly 3 decades of clinical practice, she has demonstrated that unless there are glandular issues of the body, or unless there are glandular issues or the body is already in the state of degenerative disease, instead of using drugs that simply mask symptoms and cause side effects, most health issues can be resolved by focusing on nutrition, sleep, addressing stress, reducing foreign chemicals, and proper exercise. She also has a book and course on menopause called Menopause Power, written to educate women that menopause never ends, and whether you have symptoms or not, the loss of sex hormones are forever and will affect your overall health. She's currently working on her latest book, Survival of the Smartest, and online education courses to teach you how your body works and what you can do to prevent degenerative diseases of aging. It is her work in this field that I really want to focus on today. Dr. Schwartzbein, it's such an honor to have you on the show today, and I'm so excited to hear what we're going to be discussing.
Well, thank you. Thank you for having me.
Well, so first, you know, I read that you're an endocrinologist. You know, can you tell me a little bit more? What is that, and what does that mean?
Well, an endocrinologist is a physician who studies the hormone systems of the body and in general treats the hormone glandular problems of the body. But I have taken endocrinology to another level. And instead of just looking at it from the viewpoint of glandular disease, in other words, the thyroid's not working, so that's hypothyroidism. Or a woman has had her ovaries removed, so there's problems with the sex hormones. Or somebody with type 1 diabetes can't make insulin. Those things would be considered endocrine disorders of the glandular type. But my area of focus over the last, and I can't even believe I'm saying this, 3 decades, has been to focus on the hormone imbalances that occur from day-to-day habits.
Well, I actually can remember buying your book, I believe, at Barnes & Noble back in the late 90s in Santa Monica on the 3rd Street Promenade. So I still remember, and I read your book many, many times, and I really love what you were putting forth in your first book, The Schwarzbein Principle. I mean, we're dealing with a lot of these, what I would say, metabolic diseases that are taking place, like insulin resistance. We got cardiovascular disease, and obesity is obviously it's getting worse and worse. So with what you are doing, working with the hormones, I mean, how can that impact what people are dealing with nowadays, all these kind of metabolic diseases?
Well, yeah, what we're really finding is as we're living longer, that we're actually dying of these metabolic diseases, right? We used to die of infections and in childbirth and trauma, but now we're dying of heart attacks and strokes and Alzheimer's dementia and the consequences of type 2 diabetes and cancers. All of these can be lumped into the metabolic disorders of the body. And at the hub, if you will, of these disorders, we're finding that insulin, which is a hormone, is playing a very central role. And that is what my area of research has been in the last 30 years, how insulin and the counter-regulatory hormones to insulin, which are adrenaline and cortisol and noradrenaline, to name just three, how they fit into creating or causing these diseases to occur, unfortunately, earlier than we would like them to happen. I mean, we're all going to eventually die of something. We just don't want to die early, and we certainly don't want to spend the last third of our years with a chronic disease that's debilitating.
So these, I mean, aging, well, obviously we're all age, and at some point we're going to die. But, I mean, so these degenerative diseases, I mean, I mentioned like the hyperinsulinemia, like diabetes or cardiovascular disease. I mean, what are some of the other ones that we are dealing with nowadays that really is becoming an issue? Well,
definitely we're seeing more Alzheimer's dementia. And that's being touted as type 3 diabetes now, because insulin plays a role in glucose metabolism in the brain and in keeping your brain cells alive. The other one would be stroke, and I think you mentioned cardiovascular, so that would obviously fall into cardiovascular and the heart disease that we're seeing. But osteoporosis would be another example of a disease, a degenerative disease that occurs as we age. In terms of why we're seeing such a rise is because, or even we should take it back a step further, why we're calling them metabolic diseases is because they occur when things go awry with our metabolism. And the way I like to explain metabolism is the sum of all of the combined biochemical reactions that are occurring in your body moment by moment. And to make it easy, I teach my patients to cut that metabolism right in half and basically say half of your biochemistry is all about rebuilding and repairing and restoring your chemicals, and the other half is all about you being able to function, and so you're going to use your biochemicals. So really what we're trying to do is we're trying to match or have building keep pace with using. And, a lot of people think metabolism means how fat or thin they are, but it really doesn't. It has nothing to do with that. It has more to do with how are your cells functioning, and are you rebuilding and repairing your cellular structure? Are you rebuilding and repairing your functional chemicals like your hormones? Those are functional chemicals. They tell cells what to do. Or antibodies that help you fight off infections. And now we know that antibodies help us fight off cancers in our own body. The immune system plays a big role in health, and those are functional chemicals. So are you doing what's necessary to rebuild your functional chemicals to keep you healthy as well and to keep you functioning? And then, of course, there's the energy chemicals. So you have your fats and your sugars that help drive these biochemical reactions. And so really what you're trying to do is rebuild and restore structure, function, and energy, because on a day-to-day basis, you use function, structure, and energy.
So, and the metabolism is then there to be able to support all those processes to take place. So it's not, like you're mentioning, it has nothing to do whether you're skinny or fat. It has to do whether you're able to support all these processes that needs to take place within the body for optimum health.
Yeah, not only, it's kind of all enfolded because it's not just supporting them, it is the process, right?
Yeah, exactly.
Yeah. So it's all together like that. And then what I want people to know is that your hormones determine whether you are building your chemistry or using your chemistry. And that's why, we're always talking about, why hormones are so important in health and how they help keep you metabolically balanced, or unfortunately, if they're out of balance, they will create metabolic imbalance, and that accelerates aging, and that increases your risk of developing these degenerative diseases of aging.
So when you say hormones, I mean, people
let me guess, you think sex hormones.
Exactly. So people think, well, my testosterone is fine, so my progesterone or estrogen, all that is fine. But what in reality is our hormones? I mean, what are they?
Right. Well, in reality, hormones are the chemical messengers, and basically there are what we're going to call major hormones. And unfortunately, for those of you who think that testosterone is a major hormone, it's not. But a major hormone would be something that if your body couldn't make anymore, you would get very sick very quickly and die. So insulin is a major hormone. You really can't live without it. Adrenaline is a major hormone. Cortisol is a major hormone. Noradrenaline, even though it's also a neurotransmitter, it's also a hormone. And so I'm always pitting, if you will, insulin, which is a building hormone, a major building hormone, against adrenaline, cortisol, and noradrenaline. Those are the major using hormones of the body. And your habits determine if you're going to put out insulin at a given moment, more insulin than adrenaline, noradrenaline, and cortisol, or if you're going to put out more noradrenaline, adrenaline, and cortisol than insulin. So really, we're back to saying if metabolism is about building and using of your chemistry, and insulin is your major building hormone, and adrenaline and cortisol and noradrenaline are the major using hormones, it's your habits that determine whether you're building or using, because down to the day-to-day details, it's your habits that determine what hormones you're going to secrete.
Fascinating. We're going to take a quick break, and I want to explore a little bit more about the insulin and building hormone when we'll be right back. You're listening to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Schwartzbein. Welcome back to HealthMade Radio. I'm here with Dr. Schwartzbein, and we're talking about metabolism, hormones, and you're mentioning, the using hormones and the building hormones, and then you're putting insulin in that category of building hormones. What are you building with insulin? Why is insulin important in the building process? Because we always think about that hormone in relationship to just transporting glucose into the cell.
That's a great question, because this is exactly what I'm really trying to push for today, for people to understand. Insulin is not your enemy. It is your biggest friend. It is probably the most powerful anti-aging hormone of the body. Now, don't get me wrong. If it goes awry, you're in trouble. But in general, you need insulin not only to facilitate glucose crossing into your cells, but amino acids and fatty acids getting into your cells. So the building of all your proteins and the fats and your glucose, which is important for both glycogen production, which is the storage form of sugar, or ATP energy, which you're going to take glucose and break it down and convert it into ATP. All of that is regulated by insulin. Now, think of it this way. If you think of your cell as having a membrane, which it does, and on the left side, just think of it being your bloodstream, and on the right side, it's inside of the cell. Insulin basically helps bring the nutrients from your bloodstream into your cells. And within the cells, then, it turns on different biochemical pathways and tells the body what to do with the food substances, the nutrients that you bring in. Now, obviously, different cells have different functions. So it's going to be depending on what cell insulin is talking to at the moment, that's going to determine what you build. But basically, all of, like bones, you need insulin to build bones and muscle. You need insulin to build glycogen, the storage form of sugar, and we draw from glycogen in between our meals so we don't get hypoglycemic. You need insulin to help you build neurotransmitters. One of the classic ones is serotonin. Insulin takes the competing amino acids away from the blood-brain barrier and lets tryptophan cross the blood-brain barrier where it gets into the cells, which is the rate-limiting step, in order for tryptophan to become 5-hydroxytryptophan, which then becomes serotonin. And at night, serotonin gets converted into melatonin, so insulin's extremely important for sleep. So what I've been hearing, especially in these last few years, is that, oh dear, insulin's the enemy. If you're insulin resistant, you have a disease. You're going to be you're going to be sick. So you really want to get rid of insulin. And the reality of it is, no, you don't. Being insulin resistant means your cells aren't responding normally to insulin. It's not insulin's fault. It's your cells that have been damaged. So you want to repair those cells. And guess who plays a role in cellular repair? Insulin.
So it helps. Oh, yeah, exactly. So it helps to repair the area that needs to function for itself to be able to function.
Exactly. You hit it right on the nail, Michael. That's perfect. That's a perfect way of saying it. So I know I always tell my patients, unfortunately, who are insulin resistant, I say the irony is, in order to make you insulin sensitive again, we need insulin, which isn't working really well with you right now, to help your cells rebuild and repair themselves so that insulin can work its magic again. And that's why it takes years to heal from insulin resistance.
So in regards to insulin, I mean, is there a difference then between, let's say somebody's diabetic and they take insulin versus the insulin that's regulating in our body? I mean, is it still good to take the insulin? Obviously, they need it to be able to bring sugar into the cells, but does that have a different function in the body when you have kind of an exogenous insulin like that?
No, actually it doesn't. The only thing you have to be careful about is how much you're giving. So a lot of people, since see what we've been talking about insulin, how it plays a role in not only sugar metabolism, but protein metabolism and fat metabolism, people just equate it with sugar. So they think, oh, I'll just take a certain amount of insulin for the amount of carbohydrates or sugars that I have, or my sugar's a certain level, I'll take, X amount of insulin. And if you take too much of insulin, now you have a hormone imbalance of insulin, and that's not good for you. So it really is amounts and dosages. Hormones are in the body at 10 to the minus 12, 10 to the minus 9, very, very small quantities. And when we start to inject it exogenously, unfortunately, we're ending up getting, we always get more than the body would have produced on its own given the same situation. So that's the tricky part of, insulin therapy. But if you have diabetes and you don't make enough insulin, you do need to take insulin to survive. You just have to work on your nutrition and your sleep and your stress and your chemical intake and your movement and exercise to support the body so that you're not just saying, hey, my sugar's 300, I'm going to take 10 units of short-acting insulin to draw that down. That's a mistake.
So in regards to insulin, obviously the secretion of it is stimulated by like sugar, when we ingest sugar, or carbohydrates, simple, complex, etc. And there are a lot of diets out there that are, and I know yourself in the past, you're really a proponent of eating good fats, which obviously is really important. But everyone's been going against carbohydrates, and that's what I assume it helps with the secretion of the insulin. So should we then include more carbohydrates? Is that bad to stay away from all the carbohydrates?
Yes. Okay. Good point. Thank you for bringing that up. So 30 years ago, when I first started my practice here in Santa Barbara, California, people were coming in to see me on the low-fat, high-carb American Diabetic Association diet movement. And I was just seeing, blood sugars out of control, and we were trying to figure it out. And as we worked with the diet and started to lower the carbs and bring back in the fats, everything got into better balance, and we started to see improvement. But we kind of went too far. We went too low on carbs, thinking that was the only thing we had to look at. And over the next few years, when we lowered the carbohydrate in the patients, next thing you know, they're coming in with depression and sugar cravings and rebound hypertension, and their blood sugars were coming back up again, and we were going, what's going on? And then we realized that we had gone too far eliminating the carbohydrates, so we started adding them back in. And it was at that time, as I was adding them back in, that it became very clear that it was the gluten carbohydrates that were creating more of the inflammatory process that was going on, and the higher blood sugar reactions that we were getting in our diabetic patients. So we started to go gluten-free. And I'm going to say that was about 25 years ago, somewhere in there. And then what started happening is we were able to start doing saliva testing for cortisol levels and being able to look at the adrenal glands in a different light. In other words, in mainstream medicine, the only thing you can do is inject ACTH, which is a hormone from the pituitary gland, and stimulate the release of cortisol and determine if somebody had like no cortisol production at all. And that would be called Addison's disease, which is, a failure of the adrenal glands. But nobody was able to look in between and say, well, it's not really an all or none phenomenon. Sometimes there's a some issue where you're not, you're still making the hormone, you're just not making it in sufficient quantities. So with the advent of the saliva testing, we were able to start seeing these nuances and started to realize, oh my goodness, when people start to go too low on carbs, their cortisol levels start to rise. Well, I think anybody out there hearing this knows that high cortisol levels is not something else you're aspiring for either. And so in my work, then, what I have been doing is looking at both sides of the metabolism, going, you can't just focus on one. Can't just focus on insulin without also saying, hey, what's going on with adrenaline and cortisol and noradrenaline at the same time, which over time brought me to the sympathetic nervous system, the autonomic nervous system, because that's where the majority of noradrenaline is secreted from. And we now know that noradrenaline is probably the biggest blocker to insulin that we have. And that's why people who have diabetes, when they're stressed, their blood sugars go off the roof. They don't even have to eat anything, and they have these high blood sugar readings. So, you have to take into consideration that, number one, the body is connected. It's a system of systems. You can't just focus on one area. You have to actually look at them all. And then you really do need to know, well, what habits trigger which hormones. And then you have to also understand when somebody does have a glandular problem, it's not just of that gland. You can't have hypothyroidism that doesn't affect the adrenal glands or the sex hormones or your insulin. Everything's affected. And so you have to be careful, because sometimes in the blood test, it will look like, that there's a problem with the sex hormones when it's really thyroid. That's the problem. So again, it's kind of this, I think I'm going off way on a tangent here, but just kind of, you have to look at the whole body in general to understand, which hormone is the primary issue. And you need to target that hormone because, for instance, in insulin resistance, insulin's not your primary problem. It's actually adrenaline, cortisol, or noradrenaline that are the major hormones that are out of balance in most people with, and I'm going to, make sure you understand this, with type 2 diabetes. Those are the patients who still make insulin. Not enough, but those are the patients who make insulin. So it's really more of an excess of the counter hormones to insulin. And when you tell people to eat less carbohydrates or exercise more, those hormones go even higher, creating more damage, creating more using, creating more breakdown, and eventually more insulin resistance. So my program to heal insulin resistance is very different, because I'm going to the core saying, okay, it's a problem in your cells with one of the pathways of insulin, and we have to go back there and rebuild it. In order to rebuild that pathway, you need to lower your using, your excessive using, and you need to focus on restorative building, and we need to build that pathway back. And by the way, it's going to take years to do this, and if you have type 2 diabetes, you need insulin during that time frame in order to make it happen.
Yeah, I think those are very powerful points. We're going to take a quick break. We'll be right back. I'm here with Dr. Schwartzbein, and you're listening to HealthMade Radio. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Diana Schwartzbein. So, Dr. Schwartzbein, I mean, the points you were making were extremely powerful. I mean, one is that you cannot look at one gland in isolation. I mean, it's not just a thyroid that's the issue, but it's a whole symphony of all those different hormonal glands, endocrine glands, and they all work together. And then also, secondly, making the point that it's not really the production of the hormone. It's more kind of the pathways. So it's like we're dealing with the receptors, and we're dealing also with what kind of habits we are, our lifestyle habits that are then interfering with some of these downregulators of the insulin. Tell me a little bit more. What can an individual? We're dealing with so many people having blood sugar regulation issues, and that seems to be such a core component. What are some of the habits, lifestyle habits, to help to kind of balance out this whole system? Because obviously we can't just, let's stop eating protein, or let's stop eating fats, or let's stop eating carbohydrates. Like you're saying, it's a balance of everything. So what can an individual do?
That's a great question. So just to put it in perspective for those out there listening, so 30 years ago, I was seeing people with diabetes because of the low fat and high carb movement. But today, I see people coming into my office with diabetes. And when I mean by diabetes, I mean raising blood sugar levels from the keto diets that are now being proposed, or paleo diet. And these people, they are just so upset and anxious and concerned, and they're saying, I don't understand this. I don't eat any sugar. I don't eat any carbohydrates. How can my blood sugars be creeping up? Prior to starting this diet, I didn't have, diabetes numbers, and now my blood sugars are very close. I'm being told I'm a pre-diabetic. And what I try to get them to understand is that your brain loves sugar. It runs on glucose 24/7, and if it's not going to get it from the diet, it's going to make it in your liver. Your liver is a sugar-making machine. So when you ask me what are some of the habits that create this problem, it would be eating too much protein. Just like eating too little protein is bad for you, eating too much protein stimulates the release of a hormone called glucagon, which triggers the liver and tells it to take the amino acid off the protein, the amino acid, and take off the amine group, which is the nitrogen group, and turn it into sugar. And so that's called gluconeogenesis, and glucagon stimulates gluconeogenesis, whereas insulin suppresses that. So if you're eating carbohydrates and insulin's up, you're not going to make new sugar in your liver. It's another reason that I get asked the question from my patients with diabetes. I don't understand why I didn't eat anything all night long. Why is my highest sugar of the day is when I wake up in the morning, And again, because the liver at night is supposed to be suppressed by insulin, so it doesn't overproduce sugar. And these people have a problem with insulin. The cells aren't responding to it, or they don't have enough insulin. So one of the things that people can do is eat a healthy, balanced diet. And to put it in perspective, you need half the plate to be non-starchy veggies. You need a very small portion of protein, maybe a couple of ounces if it's a meal, and maybe one if it's a snack. And of course, that also depends on how big you are, if you're male or female, or how active you are. And then you need, if you're healthy, twice as much complex carbs, because you want the insulin to glucagon ratio to be greater than 1. If it's 1-to-1 or less than 1, you're going to turn your food into sugar. And if it's greater than 2-to-1, you're going to turn too much of your food into fat. So somewhere at the 2-to-1 ratio is a pretty good ratio of your complex carbs. Don't count fruit in there. That's not a complex carb. Don't count non-starchy veggies in there. People always tell me that, they're counting the little bit of carb in broccoli or green beans or their salads. But that's not what we're talking about. We're talking about legumes. We're talking about gluten-free grains. And we're talking about the starchy veggies. So those are your complex carbs. And you want to have, if you eyeball it, twice as much on the plate as the protein, and then you want half the plate to be the wonderful salad or the broccoli or the green beans or asparagus, kale, etc.
And where does fat fit into this? I mean, since this is cell wall membranes, fatty substance, brain fatty, produce steroid hormones by fatty substance. I mean, what does fat play? How does that play?
Yeah, thank you. I always forget to mention that because I just always people are like, yes, put healthy oils, put avocado in your salads. You definitely want to have healthy fats. The other thing is in your protein, you're going to have a healthy fat, whether it's going to be beef or chicken or fish. You're going to have a little bit of saturated fat there. But you do, I'm not a proponent of low fat whatsoever, but you've got to be careful of high fat as well. Both sides, again, you know what the catchphrase of the day is? It's called balance, right? Exactly. Too much or too little of something is going to cause an imbalance. But you do want a healthy serving, and usually it's going to be, like you put some butter on your vegetables, and, you're going to have maybe a little bit of marbled meat or something, or, if you're going to have salmon, it has good essential fatty, omega-3 oils in there.
And so the healthy fats, I mean, what is there a difference between saturated, unsaturated, polyunsaturated? What are some healthy? You mentioned avocado, some oils, olive oil, I would assume. What else are some healthy fats?
Yeah, so you know what it is? What we're looking for is non-man-made fats, right? So we don't want shortenings or margarine or anything like that, okay? So if it's real, like butter would be fine, that would be a healthy fat. But in general, you're not going to eat a bunch of butter because it has animal fat in it. And so the longer the chain of the saturated fat, the harder it is to metabolize, and then it becomes inflammatory. But again, it's not something you have to just get rid of. That's the important point. Olive oil is monounsaturated mostly. Grapeseed oil is monounsaturated. You do have to be careful about the polyunsaturated, just because too much polyunsaturated can become inflammatory as well. But you do want to have some polyunsaturated oils. You definitely don't want things like canola oil. Please steer clear of that. But like coconut oil or any other kind of palm fruit oil, which is a short-chained fatty acid, those are healthy for you as well.
Wonderful. And so in addition to obviously eating becomes important, and with we're talking about the ketogenic diet, and it also comes along with that intermittent fasting, and you eat 2 meals in a day. So what would be healthy? How many meals should an individual have in your eyes?
Okay, so yes. So let me put it this way. Fasting occasionally I don't have a problem with, as long as the person who's fasting also realizes that has to be a day of quiet and calm. Okay? If you're going to fast and you're going to be running around town and you're going to be at work or you're going to be taking care of your kids or whatever you're doing, okay, then you're taking away the whole idea of putting the body at rest. So when you don't eat, your body secretes more adrenaline, cortisol, and noradrenaline. It has to break you down in order to keep you alive. So, if you're going to fast, please, make sure that you're also taking the day off and that you're not prolonging your fast. But in general, just so you know, I always have a book in the back of my mind that I'm going to write one day for that's just about diabetes. I always try to start that book, and then it becomes about everything. When it's just about diabetes, the working title is, But I Never Ate Breakfast. So skipping breakfast is the worst thing you can do, because at that point in time, your pre-made, glycogen storage. Glycogen is the storage form of sugar that's in the liver, has run out. You run out of it. At the best, you have about 8 to 10 hours of glycogen. So, if your last meal of the day is at 6 at night, and then you don't eat again until 12, you've passed your 10 hours, and you have to get glucose from somewhere. And your body is going to break down its lean body tissue, and it's going to break, which are the proteins in the body, and turn them into sugar to feed your brain and keep you alive. So all you're doing is breaking down. And again, That's what aging is. Aging is all about breaking down and the inability to rebuild and repair as well as we once could. So as we're all getting older and we're losing that ability, even under the best circumstances, to rebuild and repair, don't cause your body, don't make your body need to rebuild better because you broke yourself down even further. So I know that a lot of this intermittent fasting comes from the fact that, now we know that autophagy, when the body, kind of cleans up its own cells, extends life. But it has to be done in a reasonable manner, because if you're just going to be fasting all the time, and by the way, the question that I always pose is, why do we always go to these extremes anyway? Okay. But if you're going to be fasting all the time, you're actually going to not just clean out the cell, you're going to destroy the cell and create more damage from the fasting than what's good. So it's about, it's about healthy eating. It's about how many meals. And I like smaller meals more frequently for two reasons. One is to keep the blood sugar stable, because if blood sugars start to dip, out comes adrenaline, cortisol, and noradrenaline again, and you're breaking down. If the blood sugars go too high from eating too much, out comes insulin, and you're more apt to make more fat and store them around your organs, which isn't good either. So we want a nice steady sugar to keep all the hormones in check. And then the other reason is just, your body can't process all that food at one time, and you really want to make less fats if you and I'm not saying that you're not making any fat, because you should be eating it, but I'm saying making it from the sugars. I'd rather you take your sugars and turn them into ATP energy and have the energy to fuel all of these biochemical reactions we've been talking about. So I like, either 5 smaller meals or 3 meals and 2 snacks, again, in those ratios I was telling you about. So it's really about, the foods you choose, which should be organic and fresh and whole. And then it's really about the how many meals, 3 meals and 2 snacks, and the timing. For me, it's, you need to eat within a half an hour waking up, because you want to break your fast. You want to start storing glycogen again to calm down adrenaline. I don't like adrenaline raging. Adrenaline and noradrenaline, inflammatory hormones, they have created more disease than insulin ever will, by the way. And so I like to temper that first thing in the morning. And then it's how you eat. That's also important. You need to sit down. You must be relaxed. You take small bites of food and you chew, 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 chew. That puts you in parasympathetic mode. That's the rest and digest side of the body. You can now take your food and digest it into its components. The body won't have an immune reaction to it. You bring it into the body, the hormones are in balance, and you rebuild yourself. And that really is the purpose of eating. The purpose of eating is to build, not to break down.
Yeah, I think
that's how I like it with food. And then, of course, there's sleep, right? The power of sleep. They've done recent studies which basically says, you can eat poorly and you will get sick, but if you don't sleep well, you're going to get sick faster.
Well,
right?
let's take a quick break, because I want to be able to chat a little bit more about the sleeping and also exercise, because those are huge points that are important. We'll be back in just a moment. You're here listening to HealthMade Radio with Dr. Schwartzbein. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Schwartzbein. So you're going through what a perfect meal should look like, and the amount of food throughout the day, how many meals you should eat. And obviously, like you mentioned, it depends on the size of the individual, what kind of activity. One of the points you are making that I think people keep forgetting is that digesting and assimilation is what's called a parasympathetic function of the body. So we're all so stressed, and we all try to be so effective with time. So we think that, well, if I'm doing something while I'm eating, then I'm utilizing that time. But in essence, you're actually, it's very detrimental for your health. So,
yeah.
So what are some? We're talking about sleep. You're starting to tell us a little bit about sleep. Why why is that so important? I mean, again, we want to be effective. We want to get things done. So people, things that sacrifice is usually sleep and what we do while we're eating.
Right. So what we're finding is that, and this is not really new, but that sleep is the time the body uses to rebuild and repair itself more than at any other time of the day. And that makes sense. If we really think about the fact that I've been talking about there are building hormones and there are using hormones, and there are habits that increase the building hormones over the using hormones and habits that increase the using hormones over the building hormones. If at any given moment you have more building hormones than using hormones, you're in building mode, and vice versa. If you've got too much more of the using hormones than building hormones, you're in using mode, which, by the way, we're always using and we're always building. But again, if you kind of say, who's taking over, it's really going to be, well, how many more building hormones than using hormones, or using hormones than building hormones do I have at any given moment?
And building doesn't mean, you have a patient coming in saying, well, you need more building hormones, and say, you got to be kidding me, I'm 100 pounds overweight. I don't need to build anymore.
That's a good question. That's a good point.
So what does that mean?
When we talk about building, we talk about rebuilding, the structure and the function and the energy chemicals that keep us healthy. The fat is the extra energy chemicals that the body isn't using because you're overeating, or in some cases undereating, because undereating, when the body doesn't get what it needs to build, it's kind of like, and now I'm going to age myself, but Star Trek, when...
Absolutely, I was there.
So, when they get hit and they're like, oh my God, turn off all the auxiliary power and only keep the core power. Well, your body does the same thing when it's not getting fed well. And so people are so surprised when, they keep eating less and less and less and gaining more and more and more. They're actually sending the signal to the body and telling them, hey, you know what, just keep the core elements that keep me alive. So I need my heart to beat. I need oxygen exchange. I need to get rid of, toxic waste. But I don't have to feel good. I don't have to, I need to store energy for, when times are really rough. So I don't have to have good brain function, right? People get foggy brain in these situations. So it's really a matter of, and this is why my next book is called Survival of the Smartest, is learning about how your body really works so that on a day-to-day basis, you are doing everything you possibly can in order to improve or keep your building pace with using. So if I'm skipping a meal and not eating my first meal till lunchtime, the food, how am I going to keep going? Well, I'm breaking myself down. I don't want to break myself down. That's the last thing I want to do, because, again, that means I have to build myself back up again. And you're right. I'm not talking about, building or using, necessarily fats. I am talking about neurotransmitters and hormones and antibodies and all the things that give you good function and health. So back to sleep. During sleep, especially stage 3, which is the deep restorative sleep, in stage 3, that's when your adrenaline and your cortisol and your noradrenaline are at their lowest, so that your insulin, which is still low, is higher than these using hormones, and that's the time the body really uses to rebuild and repair itself the best. And you need to get into that mode. And what we're also finding is between the hours of 9 p.m. and 3 a.m., you will cycle more into this stage 3 sleep than from 3 a.m. onwards. So if you're going to go to bed after midnight, it's already too late. You've missed 3 hours of more restorative building time, and you're going to have to make it up with more hours of sleep on the other side. So I encourage my patients to try to get to bed. And by the way, unless they're already going to bed at 9, I don't try to get anybody to go to bed at 9. But 10:30 at the latest is where we try to encourage patients who need to heal to go to sleep. And if you can get to 9, hooray!
Yeah, exactly.
That's even better.
Yeah, I used to tell my patients, late 90s, every hour before midnight counts twice.
Right. I love it. Perfect. So I'm saying it's not news, but it's made the news, if you know what I mean.
Exactly. I think we're still, because we have so much entertainment that's taking place at night that pushes us later and later. And because of that, then we are not able to restore our body with proper sleep.
Right. Which brings me to, good segue, to the sympathetic nervous system. This is our, fight, flight, for everybody who knows it in that vernacular. But it really is turned on all the time. So you don't just go into sympathetic when you're startled. You're in it all the time because it's what keeps your heart beating. So and when you're thinking, you turn on your sympathetic. So it's really about, like, I'm going to call it a dimmer switch. How many things are you doing that are activating your sympathetic nervous system? And on a day-to-day basis, since that system runs by secreting noradrenaline, that is the basic chemical of the sympathetic nervous system, which is a bundle of nerves that come out of your thoracic spine and down in your sacrum and go to all of the organs and glands that you have and activate them. So stress is probably, again, kind of like sleep deprivation, one of the number one, problems today that we're facing. And stress isn't, oh, I'm unhappy and emotional. Stress is, how much are you doing? Back to all of the media that you were just talking about, right?
Absolutely.
So people are constantly on their cell phones now, or the kids are, or they're watching TV, or they're interacting with something, or we're always on the go, or we're over-exercising, go, 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 go. That's stimulating sympathetic nervous system. It's putting out noradrenaline. Noradrenaline is a very powerful using hormone, and it blocks the action of insulin like no other hormone in the body does.
So to become, kind of circling back, to become insulin resistant, I mean, the fastest way to do that is to not sleep, be stressed, and then obviously improper eating habits.
Yeah, and on either side, either you're eating way too many carbs, which will do it, or you're not eating enough carbs.
Yeah, exactly.
Choose the way you want to go.
Yeah, again, balance is the key. And then in regards to exercise, I mean, what everyone, they wonder, well, I can't believe that I am not losing weight. I'm exercising 5 days a week, doing lots of cardio. I'm pushing myself. I should be burning more calories, and I'm not losing weight. What's your take on that?
Well, my take is everybody's different on that because everybody has, at this particular moment, right away from anything you've been doing throughout your whole life, you either have a healthy metabolism with good habits, you have a healthy metabolism, but you have bad habits, so that's put you at risk. You already have damage, so we're going to call that compromised, or you already have a degenerative disease of aging, so you have a damaged metabolism. Those are the four groups that I look at with my patient population, and everybody gets a different exercise program depending on where they are in that group. If you take somebody who has a damaged metabolism and get them to do cardiovascular exercises, you will damage them further because that exercise is a breakdown phenomenon. But if you're healthy on the other side and you do some cardio, yeah, you break down, but your body, if you're eating well and doing everything you're supposed to be doing, your body has the ability to rebuild itself. So that, it's not so terrible on that side. So for me, exercise, you really need to know, what's your current metabolism type, for lack of a better phrase for that. And you need to know, what habits have been driving your metabolism. So you go from healthy to at risk because of bad habits. You go from at risk to compromised because those bad habits have been going on for quite some period of time. And you go from compromised to damaged because now, you've been compromised and you're trying to fix it, but you're doing all the wrong things. So that usually propels you into damage because people think that when they're compromised, they need to eat less and exercise more. And that really is the wrong thing to do. So back to your exercise question, it really is dependent. But I like interval interval cardiovascular. I never like, continuous cardiovascular. I like strength training, and more importantly, I like, the stretching and the calming side of everything as well. But I use those different, exercise types dependent on what's going on with my patient. And they're always so shocked when I'm saying to them, you know what, you can't exert yourself right now. You can walk, you can move. Movement is great, but you can't get your heart rate up. You can't be sweating. I know it makes you feel good to do that, but it's actually breaking you down further. And, if I'm going to help you rebuild, we've got to slow down the using side, and we've got to focus on the building side. And again, not building fats. That's not what we're trying to build. We're trying to build neurotransmitters and hormones and chemical pathways and cell structure in order to heal the compromised metabolism. And this is what, Michael, what I was telling you earlier that I'm going to be doing, with the programs that I'm trying to set up, is teaching people how it really works, getting them to take, an assessment to find out, are they healthy, at risk, compromised, or damaged, and then learning about themselves and what they can do in order to make themselves better, because it's not a one-size-fits-all.
And that was going to be my question, because you're mentioning these 4 different groups, and how an individual that could find out which group they're in. I mean, if that's just a subjective, you looking at a patient thinking, well, you'll probably fit in this category, or if there's
no, there's actually objective criteria.
Okay, good.
It's more like, what mood am I in that day?
Yeah, exactly. I didn't have enough coffee. I'm sorry. You're degenerative.
Yeah. So basically, to make it healthy and at risk is the one where you have to look at somebody's habits to determine, right? But when somebody's compromised, it really means they already have a component of insulin resistance, which is measurable, or they already have a component of adrenal fatigue, which is measurable, or they have a little bit of both. And there are conditions that are associated with being compromised. So, for instance, if somebody has what we call Stein-Leventhal syndrome or polycystic ovarian syndrome, that's a condition, and that means that your metabolism has already been compromised. You're insulin resistant, but you haven't destroyed the insulin side. It hasn't led to destruction of the pancreatic islet cells that make insulin. So you're not a diabetic, but if you don't change what you're doing, you're going to go into damaged, right? So that would be compromised, and the damaged part would be somebody who has ended up with type 2 diabetes. Now, don't confuse type 1 diabetes. Type 1 diabetes is an autoimmune destruction of the islet cells that make insulin, but the rest of the cells are insulin sensitive. So they're still compromised because they can't make that hormone, but they're not damaged because there's no intracellular damage that's been done yet.
Wonderful. And, so what can people do to learn more of what it is that you do? I mean, you're starting these programs. How can they take more control of their life? Right.
So, I have been in practice now for nearly 3 decades, which again just shocks me.
It goes quickly, doesn't it?
It really does. And so at the tail end of my career, so if you would, I'm just like going, oh my God, more and more people need to know what I know, because I'm watching, where are we again today? We're in this whole, low carb movement, and I'm going, I can't believe we're here. I started my whole career with too many carbs, and now we're ending it with there's too few carbs. But that's just the top of the ice floe there. It's really, if you're really interested in knowing more about yourself, you really do need to learn a little bit about how the body works. And I mean a little bit. It doesn't take a lot. You don't have to become an endocrinologist. You don't need to know how all the hormones of the bodies work. But you do need to understand the building versus the using and how to keep pace with that, and what are the habits that are contributing to what's going on with you. So I'm going to invite you, and it depends on when this airs, but somewhere in April 2019, May 2019, my website, drschwartzbein.com, is going to be launched, And we're going to have, assessments that you can take to figure out what your metabolism type is currently. And then we're going to be offering online courses so that, you actually, will be able to follow the course, get the support that you need in order to regain your health and your life back. I mean, I think it's really important. I have patients coming from all over the United States to see me because they're not getting the help that they need. And, I love the fact that there's the internet now because there's, you can get information, but there's a lot of misinformation out there. And as an endocrinologist, as a nutritionist, as a physiologist, I'm trying to set the record straight and try to get people to really understand, again, please don't look at one thing because that's what's gotten us into trouble.
Yeah, exactly. Yeah, being myopic. And like you're saying, we always want to take things to the extreme. Let's be extreme and trying to find a balance. Let's do that.
I like that. Let's be extreme and trying to find a balance. I'm going to use that.
Yeah. Great. Well, it's been such a pleasure to have you on the show, Dr. Schwartzbein. And I mean, your work is saving people's lives, and I really appreciate everything that you're doing.
Well, thank you for having me on. It was a pleasure.
Well, thank you. And so that's all for today. I'm Dr. Michael Karlfeldt with HealthMade Radio. Remember to connect with us at healthmade.co. Health is what you make it.